Hello guys! Welcome to Exquitalk. For today, we'll be tackling dental surgery. And we have the right guest today kasi alam naman natin kung gaano siya ka-experience pagdating sa topic na to. Let's all welcome Doc L.A. Hello, Doc!
Hello, Ira, and hello sa ating mga viewers.
So, ayun, Doc, alam naman natin na hindi lang pagpapaganda ng ngipin ang trabaho ng dentista, kundi para alagaan din yung health ng ating mga ngipin. So, ready ka na ba, Doc, to share your insight and experience sa mga viewers po natin?
Of course, Ira, I am excited to share my knowledge and experiences sa ating mga viewers.
So, yun, Doc, una kong tanong, ano ba yung normal extraction sa odontectomy?
Okay, odontectomy is a surgical removal of impacted tooth, which is commonly known sa wisdom tooth. Pero the term odontectomy kasi can also be used sa other impacted teeth. While the simple tooth extraction, it is also a surgical removal ng tooth from the socket. The main difference between the two is the position of the tooth. Kasi in odontectomy, the tooth is impacted. While in simple tooth extraction, the teeth are fully erupted. Pero Ira, I just wanted to make this clear kasi this is just my personal opinion ha. Kasi this is a most common misconception ng mga patient when they hear the word simple tooth extraction. The first thing that comes to their mind is simple or madaling bunutin. Pero there's no such thing as simpleng bunutin kasi lahat to surgical removal. And the term simple is used in the field of dentistry to classify the case kung ano yung bubunutin. Pero it doesn't mean na it's called simple, it is an easy extraction.
Yung info for us mga ka-Exquitalk, Doc, ano naman yung common reason kung bakit kailangan ng surgery ng ngipin?
For simple tooth extraction, the main reason bakit kailangan i-extract or bunutin ng ngipin is because the tooth is not restorable anymore. Ibig sabihin, hindi na siya kaya ng pasta. When the tooth is not restorable anymore, nagbibigay kami sa pasyente ng treatment options, which is root canal treatment or tooth extraction. Sometimes kasi, syempre as dentist, gusto namin i-save yung mga ngipin ng pasyente. Pero sometimes, patients can't afford root canal treatment. So, it leads to tooth extraction. So, for odontectomy naman, there are a lot of reasons kung bakit kailangan mag-undergo ng isang pasyente sa odontectomy. First, there's already a feeling of pain and discomfort. Second, there's infection and swelling. Third, it damages the adjacent tooth. Fourth, there's already difficulty in mouth opening. Fifth, nagkakause na siya ng food impaction. And there are a lot more reasons kung bakit binubunot yung impacted teeth. So, kailangan talaga mag-visit sa dentist para ma-assess.
Ganun pala yun, Doc. May tips po ba kayo para ma-less yung swelling or ma-less yung discomfort after the surgery?
Okay. Swelling is normal after surgery. Me personally, before I start with surgery, I let my patient take pain relievers prior or 1 hour before the surgery. Para during the surgery, less discomfort sila. And also, after surgery, less discomfort na kasi nakapag-take na sila ng pain reliever. And also, pain relievers can help reduce the swelling. After surgery naman, what I usually do is I apply bandage doon sa area kung saan ako nag-surgery for compression or to apply pressure to reduce the swelling. So for home remedy naman or post-operative treatment, pwede silang mag-apply ng ice pack or cold compress.
Ano naman, Doc, yung mga usually nagiging biggest fear ng mga patient natin na nagpapa-surgery and paano po natin na-help sila para ma-overcome ito?
Based sa observations ko, one of the biggest fear ng mga pasyente is injection. Maybe because they have anxiety, phobia, or past traumatic dental experiences. So what I do is, first, I talk to the patient in a comforting way. I try to explain to them the procedures that I'll be doing. Second, I listen to them. Kasi it's normal to feel nervous or anxious kapag magpapasurgery ka. So, I want to make them feel na valid yung feelings nila. So, kailangan ko i-acknowledge kung ano yung mga nafe-feel nila. And lastly, I give them time. I don't want to make them feel pressured or force them right away na to get surgery. So, I give them time to get ready and get comfortable before I start with the procedure.
Oo naman, Doc. Super helpful naman yan. And sa mga viewers po natin na hesitant magpa-surgery, ano pong advice niyo para sa kanila?
It's normal to feel anxious kasi lahat naman tayo may kanya-kanyang fears. Me personally, I have fears na I cannot face, but I always have to remind myself about the benefit of doing something that you are scared of. So the best advice that I could give is related to that. So you have to think that undergoing dental surgery has greater benefit than the risk. So kahit na hindi pa sumasakit yung ngipin nyo, pero when the dentist advised you to undergo surgery, for prevention, you have to do it. Kasi kung hindi, you're just going to delay the treatment. And if you're going to delay the treatment, it might get worse. Lalo na if these dental concerns affect your daily life. For example, nahihirapan ka na kumain, hindi ka na makatulog, hindi ka na makapagtrabaho, and a lot of other health risks. So, you have to think of the positive outcome. You have to think that this surgery will benefit you kasi it's for your own good. So, do it for your health and do it for yourself.
Correct ka dyan, Doc. And if gusto nyo pang malaman ng tungkol sa aming dental surgery, book an appointment now here at Exquisite Advanced Dental Center. Meron po kaming branch sa Laguna and Metro Manila. And thank you so much for sharing your journey, Doc LA.
And thank you, Ira, for having me here sa Exquitalk.
Anytime, Doc LA, and remember, your smile can change your life. See you next time sa Exquitalk, where healthy smiles begin!